Hi, welcome back. Today we're going to continue the series of bariatric surgery most Googled questions. So we'll go over those, and then I'm always going to just add in like a few patient questions that I get asked very frequently that I think are always extremely helpful, because even if people don't Google them, they're ones that I get asked very frequently. So we'll go over those. And today we're just going to focus on some of the more cosmetic concerns after surgery. And then just before I forget, I want to also go over a question that I probably should have gone over in the previous video about recovery. So, and again, when we talk about these surgeries, we're mainly talking about the gastric sleeve or the sleeve gastrectomy and the gastric bypass or the Roux-en-Y bypass. So just in terms of recovery, a lot of patients ask, well, when can I go back to work? So in general, the answer is within 2 weeks. So what I tell patients in terms of that is, again, this is a very well-tolerated surgery, so recovery is pretty quick, but it's not like other surgeries where once you feel okay, then you can go back to work. So with this surgery, yes, I'm feeling okay, but now I have to learn when to eat. I have to learn when to drink. I need to learn when to take my vitamins. So there are so many habits that need to be formed. So I tell people that even if you feel okay, and even if you work from home, you don't have to lift anything, I still encourage patients to take at least 2 weeks off, because that way you can get into your habits before then you have all the stresses of work. Okay, so that was one thing I just wanted to address. And then in terms of, a lot of patients will ask me, when can I get pregnant? When can I start that journey after bariatric surgery? So in most cases, we encourage patients to wait 12 to 18 months after surgery. And there are several reasons for this. One thing to always keep in mind is that bariatric surgery does make you more fertile. So no, it's not the prenatal that you need to take or the bariatric vitamin. It's the fact that when you lose weight, the body just becomes more fertile. So that's why, birth control has to be considered. If, an abstinence needs to be considered with the patient after surgery, because they will become more fertile. So the reason why we have them wait for 12 to 18 months is because we want them to achieve their most comfortable, their maximum amount of weight that they can lose. Some patients will achieve it in 12 months. Some patients may take up to 2 years, but my goal for a patient is to be stable at their goal weight, their comfortable weight, and then they can try and get pregnant. That way we know that when they're getting pregnant, they're starting from their weight, then they're not still trying to lose weight, and they're not getting pregnant, and then they have to catch up and try and lose even more weight after surgery. So that kind of thing. So we try and encourage that. Other things, just making sure that they're taking their vitamins. There's really no increase in vitamins, or there are no increased precautions that need to be taken when a patient is trying to get pregnant after surgery. So vitamins should remain the same, and it's actually healthier for the mom and the baby to have surgery after bariatric, to become pregnant after bariatric surgery, because it's just a better, more healthy environment for both. And then I get asked, will I lose, this is more of the stuff that I'm trying to think. I mean, definitely these are two main questions. We'll say that these are Googled questions, but they're also very, very frequent patient questions about hair loss and sagging skin. So I have a lot of patients that are concerned about hair loss after surgery. And the main things that I will look for and that I will tell them is that the main things that we're going to look for after surgery, are you taking your vitamins? Okay, like you can't expect to keep all of your hair if you're not taking your vitamins. And then protein and hydration. So we talked about this in previous videos. Protein is incredibly important for healing, and then hydration as well. So protein, hydration, and taking your vitamins. Then we're always going to check the blood work. So after surgery, we check blood work at least every 3 to 6 months for the first year, and then every 6 months for the next year, and then yearly if everything is stable. So making sure all the vitamin levels are okay, and then also just making sure that there's no anemia, like from iron deficiency, and that there's no thyroid issues. So if everything else is okay, but the patient is still complaining of some hair loss, then I would say over 90% of the time, that is just due to the stress from anesthesia. So any surgery is a stress to the body. These surgeries are incredibly quick. They're very easy relatively compared to most surgeries for the patient. And so the body, should tolerate it, but it's still a surgery. It's still a stress to the patient, to the body. So, and not only is it a stress from the anesthesia, undergoing the hospital stay, that kind of thing, but patients are also, just remember, they're restricting their calories significantly before surgery and obviously incredibly significantly after surgery. So all of those things are just the perfect environment to lose hair. But the good thing about this is no matter if everything is perfect, the patient is perfect, when I see them at their 6-month post-op visit, there are no complaints about hair loss anymore. Hair is starting to grow in again and improve. So the basic thing to always remind my patients about is that just be patient. I know it's difficult, but it will get better. So that's a common one. And then also the one that we'll leave this, on, because I hope to get into much more detail about this in an upcoming video. I have to actually learn a little bit more about plastic surgery. So we call it skin laxity after surgery. And so this can happen, anywhere. If you think about when you lose weight, you have lots of excess skin around the abdomen, under the arms, in the thighs, and this is extremely distressing for patients. So I have patients that have gotten, have lost 200, 300 pounds, and they're perfect. They're at their goal weight or close to their goal weight, and they're still distressed by the fact that they have this excess skin around their abdomen that is causing infections. It's causing rashes. I've had patients that have the excess skin under their arms that when they cook, they've gotten burned. Chafing, where I've had patients who, when they wear pants, it's so difficult to just find pants because the pants are so big in the waist, but then they don't fit in the legs because of all that excess skin. So all of those things can be addressed after surgery. And, I always kind of joke with my patients that we won't leave you hanging. So we're not going to undergo this whole life process, this life change to then make you not happy with your body and make you uncomfortable and miserable with all that excess skin. So that is part of the process. And again, same kind of thing as pregnancy, usually 12 to 18 months after surgery. I will send them to plastics for an evaluation. And in general, again, what we're looking for, same kind of thing, is we're looking to make sure that the patient is at their goal weight and that they've been stable there for a few months. And the purpose of that is we don't want to go ahead and have plastic surgery and then the patient loses 50 more pounds. They have to be at least close to their goal weight and it has to be kind of stable just for everything to stabilize. Because, with a lot of rapid weight loss, there can be some skin laxity. And then just as the body kind of gets used to it, a little bit of that does improve. So we want it to be at that point. And then the other things that we're looking for is that they're meeting all of their nutritional requirements. So a lot of times I'll have them check in with the dietitian again. Again, because protein and hydration are going to be very important for healing after plastic surgery, and then taking their vitamins. So those are the main things we're going to look at. And then another thing to remember is this is a lot more difficult of a surgery. So, as I had mentioned in the past, the gastric sleeve, the gastric bypass, those are going to be much easier than this particular surgery. But the benefits and the rewards are just tremendous because I always say it's like the icing on the cake, the cherry on top. It's just the final stage in how they feel afterwards. And it's just the completion of this life journey that they've come. So again, thank you so much for watching. Please subscribe for more content like this. I'll be doing these every week until I run out of things to talk about or I lose my voice. Ask me any questions below. I'll answer them and get into more detail in upcoming videos. So please comment, like, and subscribe, and I'll see you in my next video. Thanks.